Health meeting of October 21st, 2024. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Healy's March 29th, 2023 signing of the Acts of 2023 extending certain COVID-19 measures adopted during the state of emergency, suspending certain provisions of the open meeting law until March 31st, 2025. This meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 508-945-4410, and the conference ID is 371-903-537#, or join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Chatham TV, Channel 8 and 1072, despite our best efforts, we may not be able to provide real-time access. We will provide a record of this meeting on the town's website as soon as possible. I'll turn the meeting over to our chairman, Dr. Noble Hanson.
Thank you. It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. So we have two items on the agenda today, and first we'll establish a quorum. So when I call your name, please say present. Carol Boyce.
Present.
Ron Broman.
Here.
Dick Edwards.
Present.
Noble Hanson, I'm here. So we have a quorum. And first on the agenda is preliminary subdivision plan review for Ronald Rudnick, 104 Kroll Road, East Southeast LLC. And we have Terry Eldridge as the presenter, applicant.
I don't see him here or online. This is a preliminary plan. I mean, I can try and answer some questions. It's going to go back to the planning board, and then it'll come back to us again as a definitive. So we could still take a look at it.
Yeah, I just say, is there anyone in the audience or online that have something to do with the 104 Kroll Road preliminary subdivision again? Okay. So we can discuss it, and then it'll come back for a final approval at a later time?
Mm-hmm.
Okay.
I am going to share my screen, if I can get that to work, so you can see it at home. You've got my...
A lot of apps.
All right, there we go. So this is on Kroll Road, 104 Kroll Road. The theater is where you see Lot 2 on the left side. The plan is to take the lot to the right of the theater lot, which is now labeled Lot 24, 25, and 23. Split that into 3 lots. This is on sewer. And then they're also requesting a small portion of Lot 2 to add to Lot 25 in order to give that the required frontage that they need for a building lot. Again, there's no more detail than that. I think that we're going to need more information, and the planning board will be getting more information moving forward.
So the zoning rules require 100 feet of frontage on the road for a building lot today?
That sounds right. I'm not a zoning expert, but that does sound
So
right.
by putting this road
Right.
in the panhandle there, then that's why they need to get that additional 27 feet from the Drama Guild, so that they would then have 100 feet of frontage?
Yeah, and then the Panhandle lot, I don't know how that works, actually.
Well, they don't have any frontage, I guess, you know.
Right.
I don't understand the frontage business.
They didn't give us any drainage information either. So this will need, from my understanding from talking to the town planner, this will need some more information before they'll approve it.
This is gonna connect to the sewer,
Yes,
so there's no question about that. That's gonna be, they're not gonna put in any septic system or anything. It's gonna just
no,
connect to the sewer.
it'll be connected to the sewer.
Yeah, and then, because of that, the issue of the number of bedrooms allowed for the size lots and all that will come under the sewer regulations, which comes under the select board and not us. We're not,
Well, I mean, they're allowed what we would have allowed under our regulations. So a 16,000 square foot lot would be allowed 3 bedrooms. Because our regulations said, before we changed that any well, they still say, any vacant lot is allowed 2 bedrooms. And then with sewer, we would allow the third.
So if it was a septic system, they'd need an IA system, but since it's a sewer, they can
Yes,
just
right.
have the 3, but they can't have 4.
Not unless they get approval from the sewer department.
So we really don't have anything, any involvement with this at this point.
No, it's just a recommendation for, you don't see any public health reasons, concern that this would not be able to be buildable for sewage disposal or any other environmental health issues.
And if they can't purchase Lot 3, then the whole thing falls apart.
Right.
They may only be able to have 2 lots.
So this may come back to us in a different reiteration. Right.
Okay.
okay, it looks pretty straightforward from our role, so it'll go to what, planning board, and then it'll come back to us. We'll take a vote at that time.
Well, you can take a vote to approve the preliminary
Oh,
as
without
presented.
without a presenter.
Yeah, you
Okay.
can.
Motion to approve.
Okay, and a second?
I'll second that.
So it's a vote to approve the preliminary subdivision. And any input from the public? Comments? And I think we can take a voice vote. All in favor of approving the preliminary subdivision, say aye.
Aye.
Aye. And opposed, say no. Okay, so that is granted. Okay, next on the agenda is the Lower Cape Community Health Needs Assessment Review and Discussion, and Judy has been working on this and is a part of the group, and she's going to make a presentation and tell us what this is all about and what the results of the assessment are. So I will turn it over now to Judy.
And I'm going to share my screen again. Get that. Get my slideshow. Okay. So, I participated with the communities of Brewster, Chatham, Harwich, Chatham, obviously, Harwich and Orleans, this April into the summer to conduct this Lower Cape Community Health Needs Assessment. Just keep going. So tonight I'm gonna give you a very brief presentation on the outcomes, and I do urge anybody to take a look at the full report, because there's a lot more in-depth information, and I did provide it, and it will be on the website. It's on there now, I just have to make it easier for people to find, so I'm gonna do that. And we're gonna do the overview, goals and objectives, methodology, key secondary data findings, some voices from the community, some quotes from people, and just basic results, and identify some of the needs that we saw. So from April to July, Crescendo Consulting Group, whom we hired, partnered with Barnstable County and our Lower Cape towns that I mentioned to do this community health needs assessment. So what we plan to do, what we wanted to do is establish a profile of community needs and resources, identify key needs and the populations most impacted, use both quantitative and qualitative data for insights, and help guide strategic planning for community health improvements. So that last part is key. The health agents have joined together in a regional public health group, which is most of the towns on the Cape right now, and we have funding for that group, and we wanted to see in the lower part of the Cape what our needs were and what the best way to possibly use that funding from a regional standpoint moving forward. So that's kind of where we came up with this idea. Let's see. Why is this not going? Whoop. So our goals and objectives were to do a community-wide exploration, engaging a broad spectrum of the community, and highlight key areas that are both common across the region and unique to each town, and prioritize the needs of the region and the towns, and identify actions and strategies for moving forward. We did secondary data research, which is gathering data from analyses that have already been done. And we did stakeholder interviews. We did focus groups, which you participated in. We did a community survey, which was a paper survey, and an access audit. So I'm going to go through those as we go through. The secondary data was completed from data pulled by Barnstable County and other Lower Cape towns, where we looked at social determinants of health and behavioral health related measures. Basically, we used some surveys from the Census Bureau, the 2018 to 2022 American Community Survey, which is a 5-year estimate that the CDC puts together, and public health, Department of Public Health data, and other resources. We also did stakeholder interviews, 19 one-on-one interviews. Each town gave a list of who we wanted to be interviewed, who we felt were important voices in our community. Some of those people were overlapped, and we were able to do 6 stakeholder interviews, in-depth interviews. We did 6 focus groups in the towns. Each town did one, and then they did some more general ones across the region. And the access audit was done. They made calls to 13 facilities, including healthcare, behavioral health, primary care, and community assistance programs. Those were basically to see what the barriers to care are. So if you cold call people and say, I need an appointment, or how easy it was to get through and talk to someone and actually get access. And there was a paper survey as well. We got 384 total responses from community members. We had a very large response in Brewster, and Chatham had a fairly large response as well. We just have a few notes here, see if there's anything I'm missing. Just gonna keep going.
Judy, why was it, do you think, larger in Brewster, the response?
Gonna get banged on the window.
Judy, why do you think the response in Brewster was larger?
I think it had something to do with the way it was put out into the community by a board member or something.
Methodology.
Yeah, they were quite successful in getting it out there.
How many surveys were sent out?
The surveys were all done online, so it was a link to go in and
The 384,
those are the responses. So we had total, yeah.
so it wasn't a paper survey?
No, there were paper surveys available.
So do you know how many
But I don't-
people received the survey? How many?
Well, again, it was online, so it was an open, they weren't sent to people, it was
Oh, they weren't
advertised.
emailed to them? They
No.
You had to know there was a survey?
Right, and we put that out there in online and in the media and the paper, and, we mentioned it at Board of Health meetings and such. So we did our best to get it out there. So I'm going to start with some of the secondary data that I mentioned. This is kind of a snapshot. I think it clearly shows in the communities, Chatham being here on the lower left-hand corner, population by age, no surprise, median age is 64. Most of our community are age 65 and older. Chatham and Orleans are the two of the older communities in the state. So Harwich and Brewster have a younger demographic, as you can see by this slide. And of course, older populations have different needs, require different services. They're more vulnerable to social isolation, cost of living changes, and mobility and transportation issues. So that's information that we can use when trying to decide what services are vital to the people of Chatham. Chatham, as you can see, 92.5% white, 1.5% Latino, and 2.5% speak language other than English at home. I don't know what else to say about that. The racial, ethnic, and language breakdowns of populations do provide insights into a vulnerable population that may need trusted community partners. But again, we seem to have a more white, affluent population here in Chatham. 1 in 10 adults age 65 and older in the lower Cape towns live alone. So this is not just Chatham, but we do, again, have a large percentage of population living alone. And that's important because we can have social isolation, aging in place without resources, climate change impacts, mobility issues, disability issues, financial stability, and transportation. These are all good plugs for our Council on Aging and Center for Active Living and the great work that they do. And most communities are prioritizing that type of work.
Judy, where did this data come from again?
This is from the, well, these are secondary data findings, so
Okay,
these are.
it's not just the survey.
This is census data, basically. So it just gives us an idea of what the community looks like. Medium single-family home costs. This is interesting. As you can see, Chatham is the top line here from 2019 to 2023. The median age, the median single-family home cost has gone up from approximately 800,000 to over $1 million. High housing costs, obvious is contributing to the housing crisis and providing problems with finding employees to work and live in our communities, police, fire, teachers, et cetera. This is an interesting, again, these are regional, some of this is regional data. People living in poverty. As you can see, Chatham is in this dark number here on the, where we are on the map here. We are considered, we have 10 to 16% of our community living below the poverty level, which I think a lot of people don't realize. So even though we are an affluent community, we do have areas of town that people are living below living wage, which is, they say is $43.91 an hour, where the minimum wage is actually $15 an hour for a three-person family. So that's telling, I believe.
What's the definition of poverty?
That's a good question. I'm not sure whether they use on this percent probably below poverty level at census tract. I'd have to find that out. I don't have that. I'd have to look and see if it's in the deeper in the report. So I will find that out. Food insecurity levels have increased 20% in Barnstable County since 2018. You can see them fluctuating. We all know that the prices, the cost of living and the cost of food is all related. especially with those with lower incomes and lower wages. It's definitely a problem. Cape Cod does have an extensive network of pantries and food programs, but it can be an issue getting access. So more findings. Barnstable County ratio of people per healthcare providers. To me, this OB/GYN number, there's 6,000 people to every one OB/GYN on Cape Cod. Whereas for Massachusetts, it's about 3,000 to 1. We talked, I think, at our forum about the difficulty in finding primary care providers. I think we've all been affected by that. Dentists are difficult to find as well, and pediatricians.
So the OB/GYN is the number of OB/GYNs per total population? So the
Right.
percentage of, well, for OB, the percentage of women in Chatham in childbearing age is pretty low.
Yeah, that's for the whole region, so Barnstable County. So in doing this survey, the Crescendo put together just some quotes from people that they talked to in interviews and in surveys. We had talked about some of the opioid issues in the past. Lower Cape towns have more than a drug use problem. There's a lack of education about what's happening in the community and how people who are struggling with these issues, and how to help people who are struggling with these issues. Issues in towns do exist, but certain members of the community have such a deep stigma about things like substance use and mental health that they don't talk about it. It's likely that everyone in this community has been affected or knows someone that has been affected by substance use, but no one talks about it. When we don't talk about the issues, we can't deal with the root causes and work on preventing them in the first place. There was a question on community strengths, so it's not all bad, and, well, I guess I can keep going with our community connection. Somewhere to meet up, we need somewhere to meet up that's not a bar and doesn't require money. We don't have teen activity centers that focus on physical activity or healthy pastimes. I'm not sure that's true of Chatham, because we do have a very active community center that works with our kids. But again, this was across our 4 regions, our 4 towns. The COVID pandemic made it every man for himself. We need accessible free events where people of all ages can interact and learn about their neighbors. Just a few comments that came up. And I just wanted to give you something from community strengths, so it's not all bad news. In Chatham, we had a quote, "There's a real sense of community and support. It's a small town where people know each other and find ways to work together. There are low taxes and a well-run government with an absence of partisan politics." So that's an interesting, positive comment. So I'm going to go right into the community survey results. According to the survey, the top 3 general health issues community members struggle with, again, primary care services, healthcare services for the elderly, and healthcare services for adults. No, not surprising, I don't think. Top 3 health screening and education programs that community members would like more of, programs that encourage and facilitate healthy aging, programs for skin cancer screening, programs for sun safety and awareness. These are all things that I think we can work on, and we're doing quite well, I believe, in programming at the Council on Aging. We've started a new adult day program. Skin cancer screening, we're going to be doing some health fairs, and I know Barnstable County does a lot of education around skin cancer screening, so that's an interesting one. Let's say sun safety awareness as well. Top 3 general community issues: access to affordable housing, livable wages, job opportunities, and affordable quality childcare. Those are big issues that I don't believe on the local level we can address, but working as, in conjunction with other departments and agencies, we can hopefully make an impact in those areas. Top 3 mental health and substance use programs that the community lacks but needs are counseling services for mental health issues for adults, counseling services for mental health issues for adolescents and children, and crisis or emergency care for mental health. No surprising that mental health is a big issue in people's minds and the lack of availability for care. Current mental health and substance use needs in the community. 1 in 10 survey respondents said that they had an adult family member with a current unmet mental health or substance use need. More than half of the respondents reported experiencing depression and/or anxiety over the past 2 years, and half of the respondents did not know or are unsure of where to turn for help if they were experiencing mental health or substance use challenges. Current community knowledge and interest in local and county health departments. This, I think, is interesting. 2 in 5 survey respondents know what the local health department is responsible for in the community. So that's not very many. Only 1 in 3 know what the county health department is responsible for, and 3 in 4 would like to learn more about the local and community health departments. So that's, again, something that we can address directly, and we're hoping to do that in the next few weeks at our board meetings. Based on all the information gathered during the Community Health Needs Assessment, a list of needs was created and organized into high-level categories. This was something that we kind of did at the health agent level. We took all this information, we said, okay, what are these needs and how can we address them? From left to right, community education, increase the presence of the local health departments, learn about existing resources, and reduce stigma about community issues. Next was substance use early intervention programs, substance use disorder treatment and recovery options. We're working on that, not just locally, but regionally with our opioid funds that we receive from the state. So hopefully we're going to chip away at that. Mental health, enhance mental health crisis services, increase options in mental health counseling, youth and adults. Again, Chatham has just hired in the past year an adult mental health clinician, and we also have a recovery coach, and they're working closely with the health department and the EMTs and the police and fire. So I think we're working on this, and they're doing a great job. It's been very successful so far.
Judy, how do residents access the adult mental health clinician that the town has now?
They can call the health department and we can put them in touch. They can call the police department or the fire department. They're available. They work out of I think she works out of the police department. The recovery coach works out of the police department, and she's there every Wednesday from 12 to 4. And the mental health clinician works out of the Center for Active Living, and she's full-time, so is available.
And are these free services if you go and see them?
Yes.
Yeah.
Yeah. They're people who can guide you to the services that are available. So they're not going to become your private mental health clinician, but they're going to coach you and guide you.
Who's paying for all this?
The town hired a full-time.
Yeah, that's more money.
That was passed in the budget last year, and that's a full-time position. They actually approved 2 positions, one for an adult and one for a teen and youth counselor. That position has not been filled. The recovery coach position is, the opioid funds are being used for that. So
this is something that can continue with the program? In other words, we're not going to run out of money in a year or two?
Nope. The opioid recovery funds are guaranteed for the next 16 years. We're going to receive over $300,000, and we're using funds to enhance these programs. So it's a positive thing. So community well-being, additional community health programs, address issues with senior isolation. Again, I think the Center on Active Living is doing a lot of great programming in those areas to bring people out of their homes and, you know, get people together and work on loneliness issues, and lots of exercise programs and lunches and you name it. They're doing all kinds of great stuff. So you know, I hope people will check into the Council for Active Living, what they're doing in our community.
Did you say that there are other funding sources that are coming into the, to deal with the results of this survey that are available besides the opioid funds?
For this survey,
Well, to implement what the survey recommends.
we have our Public Health Excellence grant, which is to form a regional health, taking all the health departments and regionalizing them. We have funds, and we have to use that funding as we see fit, and as what would be approved by the Department of Public Health. So yes, there is some funding, and we are going to be using the results of this to look at ways that we can satisfy some of the issues that we're seeing here in the next.
And then that
Few years.
that goes through the group of health departments on the Cape as a whole, some sort of a,
Yes, yes.
okay.
There's, I think, 12 or 13 of us that are in this coalition now. So this was a kind of a subgroup of the bigger group that did this survey, that did this needs assessment.
And any general ballpark figure about what the amount of these funds ranges around?
I couldn't give you that off the top of my head. We have Katie O'Neill, I think you've met, she came and spoke to you, she's the director, so we have staff.
You have full-time hired people.
Right.
Yeah.
Right. So, but we're trying to come up with ways to best use the money to address some of these needs. Again, going down this list, the bigger things that are harder to address are primary care gaps, senior health care, including home care, transportation. Those are a little above what we could probably do at the local level, but always working in support with other groups on the Cape. Affordable housing for community infrastructure, affordable housing, available housing, recreation, food access, childcare. Again, a little above what we can do on the local level, but always supporting agencies that do this type of work, and local town departments around affordable housing and et cetera, rec, food access, et cetera. Let's see. So that's the basis of it. Again, I really encourage you to look through the report. It's really easy to read. There's a lot of really interesting stuff in there. It breaks down, I mean, I just gave you the basic data. There's a lot more information breaking down how Chatham is, what we really look like, you know, high school education, population changes in the last, 20 years, median household income, et cetera. So there's a lot of great information in there, and a lot more information about what the survey found. And again, to answer your question before, we are looking at this data, and we'll be meeting and trying to decide ways to, I think a lot of it's going to be about community education. I think that's going to be the biggest need that we saw, that getting the information out to the community as to what services are available and how we can support people moving forward.
Any specific suggestions for things that should be set up differently, with food pantries or transportation, or any specific things that came out of it, or is that next part of it?
We didn't get down too much to the nitty-gritty on transportation and food pantries, et cetera. I think that we have a good network of food pantries here that are doing a good job. Transportation, which can be barriers to care. We do have a fund from our opioid fund to help people that are in need to make appointments. We can use some of that funding. There are other agencies like Lower Cape Outreach, et cetera, that have funds to get people where they need to be. The Council on Aging provides transportation. The DART service or RTA, they will bring people. It's a way of, it's really about connecting people to what's out there, what the services are and connecting people.
There used to be a service in Chatham where older people could get rides from, I forget what the name of the agency was, but they were volunteers who would use their own vehicles and drive people to doctor's appointments or other appointments, and then during COVID, it fell apart.
Yeah.
I have a friend who's 95 years old who used to use that. He used to drive for them all the time, and then when he was in his 88, he was driving people to Hyannis to go to the doctor. But then COVID came, and it sort of fell apart, and I guess it's not getting. It isn't reinstated.
Yeah, was that it was like the fish program or
Angels
something?
fish, I guess.
Yeah.
Is there
I don't know if that still exists. I would have to find out. A lot of this information is available through the Council on Aging, the Center for Active Living. They have great contacts in all the local communities and can help people that need those types of services.
But if you do notify the Council on Aging, I guess, within 48 hours advance, they provide really good service. This guy, about 3 months ago, had an appointment in Hyannis, and he wanted to go to a Romeo Club meeting in Yarmouth, and they took him to the doctor's visit in Hyannis, waited for him, picked him up, and then took him to the restaurant in Yarmouth for his club meeting. So you can get very good service from those people. People need to know it's available.
Right, exactly.
And
And our next meeting, we're going to have a forum with a few agencies that are available in Chatham. The Community Services Director,
Yeah, we could, so this is community health, and part of this discussion in our survey before, a lot of it led to community services. So at our next meeting, we're having a little forum on community services. We'll continue the discussion here, but just to answer Judy, and that will be AIDS support group of Cape Cod Narcan presentation addressing opioid issues. The SHINE program by Pat Burke, which is done over at the Council of Aging, which is for Medicare programs. Leah Lacrosse, Director of Community Services in Chatham, works for the town of Chatham, has a lot of knowledge we're asking about, I think, and we'll cover a lot of that. And then Morgan Eldridge from the Fishing Partnership will address the fishing community and their issues and services available to them. So that'll be hopefully a lot of information there and answer a lot of the specific questions that I think this brought up. But then we'll go back. Any more questions or comments about Judy's presentation? And
I think this concern about the availability of primary care continues to be a big issue. And I think it's just critically important that people realize that physician's assistants and nurse practitioners provide excellent primary care. And you can go to Outer Cape Health Services and have an appointment for a new primary care visit in 2 months with somebody who's not going to charge you concierge doctor fees. And I use them, and right now I'm having a lot of issues, and they're great. They're absolutely great. You call them, and you can see them within 2 days. If you've got a problem, they set up consultations. They do everything very well.
Are you talking about nurse practitioners, physician's assistants?
Yes.
Available to you? Yeah.
Right. If you call Outer Cape Health Service, you need new PCP, you will have an appointment for an initial visit for a PCP in about 2 months.
Yeah.
And it's a physician's assistant or a nurse practitioner. There's a physician in the building if there's something that they can't deal with, but they can deal with almost everything that a PCP needs to deal with and do it very, very well.
there are community health operation. I mean, they're funded by the federal government, and that's their job, is to be available to the communities that they serve. They do a great job at it, and they were there during COVID. I worked very closely with them, getting out vaccine and testing, et cetera. So I agree, they're a great organization.
There needs
They're
to be
actually
some way to
funding.
get over this
they're-
reluctance.
Yep.
to go there. When you call there and they say, well, you'll see a nurse practitioner in 2 months, and people will say, no, I want to see an MD. And they say, well, we can't do that here. We have
Right.
extenders. And people
Yep.
will hang up and then wait 8 months to find an MD. It's crazy.
Yeah, I would agree totally with what Dick said. Nurse practitioners and physician's assistants, I mean, they can do the routine day-to-day screening and reminding you of tests that need to be done, follow your data. And with the shortage of PCPs, it's kind of the wave of the future that they're going to be used more and more, and they can certainly do the job and then make referrals as needed. But any comments or questions from the public or from anybody in the room, or any other board comments or questions?
You can go up to the mic, please?
Hello, I'm Pat Burke from the
Yes, Pat.
Council on Aging.
Your name has been,
I'm surprised
Welcome.
that there's not more people here. I talked this up at our meeting this morning because Judy had sent me the report, and I thought the report was excellent. I thought it was extremely well done. I thought the data was, for some of us, nothing unexpected.
nope.
I think Chatham is in a better place than other places. I can give you the federal poverty level if you'd like. So in
Yeah.
2024, a family size of one, the federal poverty guidelines, the annual income is $45,180. For a family of two, $61,000, three, $77,000, and four, $93,600.
That's
So-
for the country?
These are the federal poverty guidelines, yes.
For Chatham, or for this
No,
area?
not for Chatham, I don't, these are just, so when you look at people that may need services, there's the federal guidelines, and then they could keep going up, like what's 150% of the federal poverty level, which I used to know off the top of my head, but can't bring it to the front. So when you're trying to gather information to get people into services that they need. There are many new services available to people, particularly people over 65, in Chatham through the Medicare Savings Program, but it's, you need a lot of money to live nowadays. You know,
In
it's-
Chatham, right.
well,
But
I
if
don't
you had
know.
if you're a single person with a family income, with an income of $50,000 in Louisiana,
Right.
you're not in poverty. But in Chatham, you're in abject poverty.
Yeah.
So those numbers are strange if they're for the whole country.
They put them out every year. The federal government puts them out every year, and I don't think probably the latest ones aren't out. But I just wanted to commend you, Judy, because I thought the data was excellent, and I thought you would have a lot of people here. And I was going to log in, but I thought, oh, I'll just come because there'll be so many people. I'm surprised.
I think Judy has tried to put out the word, especially for our next meeting.
Yeah.
Which will have a lot of information in it. So we'll work on that. But I would ask you, so the Council of Aging, what transportation services are available to get rides to Boston, to hospitals, or your local primary care centers? Are there, Dick brought that.
I'm sure Leah will cover this next week when she's here, but
Yeah.
we have 4 drivers. And, I was at the meeting this morning, and I can't pull from my memory the number of rides we gave each month, but it's a significant amount. We drive people back and forth to the Orleans Supportive Day because ours is yet to open. Doctor's visits, if people need to go to even the grocery store, they will go to the grocery store and pick up groceries and bring them back.
These are volunteer drivers? These are
No, they're paid. They're
paid.
employees of
Council
the
of
town
Aging.
of Chatham. Yep,
through, and so you contact the Council of Aging and you can,
you do,
And they're- and
and
it's
you
a
can
free
set that
ride.
up. They're very busy, but they make,
Yep.
I mean, they're tremendously dedicated, and they will make adjustments for people. They will take the time. I mean, I had a fellow come in to see me one day who needed to go home and get something for his visit with me, and they drove him home, drove him back, waited for him, and then drove him home again. So they're very, very dedicated. So,
okay.
thank you, and thank you. I'm sorry you don't have more people here. I was very impressed
Well,
with
it is
this.
archived, so people can go on the website and.
Thank you, Pat.
Thank you. Okay, other comments, questions from the board, or follow-up from Judy?
Yeah.
Ron?
Anything on the transfer station? I know you sent out a
Like
letter.
old new business?
No, I have not heard an update on that. I don't think he has given his presentation, Rob, yet. He was going to be presenting to the select person, the selectmen, the select board, I should say. And that would come up at that point, I
It
assume.
hasn't been done yet.
I don't think they've done I think it's in November.
Any feedback about the letter that we sent, recommendation letter about the transfer
No.
station to the?
Nope, I've had no feedback. Again, that might be something they'll discuss when they have Rob Faley in to discuss the transfer station. That would be my guess.
Other old business or? Okay, and we went over the form at the next meeting, so that's good. So we have, I think, a set of minutes from October 7th. Anybody have any additions or corrections to those? And if not, maybe I can get a motion to.
I move to accept the minutes.
In a second.
Second.
All in favor, say aye of
Aye.
accepting the minutes. Aye. And opposed? Okay, so those minutes of October 7th are accepted. And I think we can adjourn the meeting. Can I get a motion?
I move to adjourn.
Second.
All in favor, say aye.
Aye.
Aye. And opposed? Okay, the meeting is adjourned.